Thanks for taking the time to watch this video. We put this video together as a set of post-operative discharge instructions for you since you have recently undergone or you're about to undergo surgery for back pain for something we call Notalgia Paresthetica. In this case, we're talking about the nerves in the back, the superficial nerves in the back that are responsible for sensation to the muscle and to the skin. And so I want to go over with you what you should expect after surgery and what you should do and what you shouldn't do about this. Okay. Now, a lot of people will wonder, well, why are we doing this video? I got a lot of this information in the recovery room. The main reason for it is so that you have a reference, because a lot of times patients in the recovery room won't remember everything that they were told. They're like, I can't remember what he said. I can't remember what the nurses said. I can't remember what I'm supposed to do. And so this is a reference you can turn to and watch over and over and over again as many times as you need to in order to get the information that you need. Okay. And so let's jump right into it. Okay. You will find that with all the discharge paperwork that you received, you will receive a piece of paper that looks like this. Okay. These are your discharge instructions in the form of a graph. Some people find it easier to look at a graph to see exactly what it is they're supposed to do and when they're supposed to do it. You also will have received in your discharge instructions that look like this. It'll be the only piece of fluorescent paper in all of the pieces that you get. Okay, that's the same information, just presented in a different format, because some people find it easier to read and other people find it easier to look at the graph. And then, of course, we're going over the same discharge instructions right here in this video so that you have it in 3 different formats. One of the advantages of having the video is that it's a resource that you can share with your family members also. If you have your family members who are going to help you after surgery, this is a great way for them to understand better exactly what it is that you can expect and what we expect from you. Okay? Now, for some of you, your incisions will have been closed with sutures. For others, your incisions will have been closed with surgical glue, and for other people, we will have used what's called a zip line wound closure. That decision doesn't get made until the very end of surgery, depending on a number of different factors. And so I'm going to include all of those instructions here so that you have all that information regardless of which one of those closures you had. Okay. Obviously, we did this surgery to help treat your pain. You should expect to have some pain after surgery because you've just undergone surgery, but it is my hope that that you're already starting to notice a difference in how you felt compared to before the surgery. And we're here to help you through this whole process. So please don't be shy. Reach out to us if you have any questions or concerns. One of the other sheets that you will have gotten in your discharge instructions is this one right here. We're going to go over this in some detail here momentarily, and I just want to make sure that I mention it beforehand. Okay, so let's go over activity restrictions. Number 1, after undergoing this surgery, it is important, really, really important, that you not go swimming and not take a bath. It is okay to take a shower, okay, but immersing the wound in water is a bad idea. It'll significantly increase the risk of wound breakdown, in other words, the wound opening up, which we don't want. It'll also significantly increase the risk of an infection, and that's something we're also trying to avoid. So for the first 4 weeks after surgery, it is okay to get the incision wet in the shower, but it is not okay to take a bath or to go swimming. Okay, that's very, very important. Another thing, you'll hear different people talk about, oh, you should use hydrogen peroxide, you should use alcohol on your wound in order to prevent an infection. I would advise against that, particularly with this surgery. We don't want you using alcohol on the incision. We don't want you using hydrogen peroxide on the incision, and don't use Neosporin or anything else on the incision that we didn't explicitly tell you about. Okay? If you have questions or concerns about that, send me a text message or give me a call. You'll notice that on the bottom of this discharge instruction sheet is my cell phone number. Okay, all of my post-operative patients get my cell phone number, and so just give us a call if you have a concern. Send me a text message, give me a call. If what you've read and what you've seen and what you're hearing me say now doesn't make sense, that's available for you as a resource as well. Okay, so you can get the incision wet in the shower, but please don't go swimming and don't take a bath until you've been cleared by me or Steve to do so. Okay. Other activity restrictions. For the first 2 weeks after surgery, it is important that you not lift anything heavier than a gallon of milk. Okay? For the first 2 weeks after surgery, don't lift anything heavier than a gallon of milk. The reason for that is that we don't want the wound popping open, and we also don't want you causing a bunch of bleeding that could occur if you overdo it. Okay? So for the first 2 weeks, don't lift anything heavier than a gallon of milk. The third week after surgery, you can lift up to 20 pounds, and the fourth week after surgery, you can lift up to 40 pounds. After 4 weeks, assuming you haven't had any wound healing problems, there are no longer any activity restrictions. Okay, but please try to stick with those activity restrictions in order for you to get the best results. Okay, so that you have fewer problems and decrease the risk of complications, and so that you get a great result, because obviously we're going through the trouble of undergoing surgery. We want you to get the best results possible. Okay, you will notice that on your incision, regardless of whether we use stitches or surgical glue or the zip line closure, that you have a simple bandage on there. That bandage is waterproof. Okay, it is okay to get that wet in the shower. However, I would recommend if you're going to get in the shower, that you just take the bandage off and then make sure you dry off the incision after you get out of the shower. Make sure it's really dry before you put on a new bandage. Okay, don't wear a bandage into the shower. You can wash it off gently and then put a new bandage on there after you've dried it off. The main reason for the bandage is twofold. Okay, number one, sometimes people's incisions ooze after surgery, and so we want you to not make a mess on your clothes, and so the bandage is helpful for protecting your clothes in that way. The other thing is that if you have either the zip line closure or you have stitches, if you don't have a bandage on there, sometimes those things get caught on your clothes after surgery, and so obviously we don't want your clothes getting caught on the stitches or on the zip line closure, and so putting a bandage on there to protect that is also helpful. Beyond that, there's not any other medical need for a bandage afterwards, and so if you find that it's easier, let's say you wear a lot of really loose-fitting clothing and getting the stitches caught on stuff isn't a concern, then I'll leave that up to you to decide whether or not you're going to use a bandage. But make sure if you have a bandage on that you take it off before you get in the shower and put a new one on afterwards if you're planning to use a bandage. Okay? A couple other things. You'll notice that you have recommendations for a number of different medicines to help you with pain after surgery. Okay, and those medicines have a particular way of being taken, and there are particular reasons for you taking them. Okay, so I want to go over each of those right now. As far as pain control after surgery, it is important to take Tylenol extended release. Sometimes it's called Tylenol arthritis or Tylenol 8-hour. You will also have received this in your email, and you'll also have received it as a hard copy. Okay, so you'll notice on here there's a picture of which version of Tylenol you should get and which versions of Tylenol you should not get. It's important to keep that in mind because I want you to take this Tylenol every 8 hours, and if you take the wrong version, you do run the risk of an overdose. So make sure you have the right version, the extended release 8-hour Tylenol. You're going to take that 1,300 milligrams, which is 2 pills, okay, every 8 hours, whether you have pain or not. And that's important to do for the first 4 weeks after surgery. Okay, whether you have pain or not, unless you hear from me or Steve otherwise, take the Tylenol every 8 hours around the clock in order to help control the pain. In addition to that, I want you to take some ibuprofen. That'll be 800 milligrams every 8 hours. Now, of course, some of you are thinking to yourselves right now, okay, well, that means I have to take the ibuprofen at noon, and I got to take the Tylenol at 4, and then the ibuprofen at 8. The reason we chose the 8-hour Tylenol is to make it easier for you to keep track of your medicines. Tylenol and ibuprofen do not work the same way, And so it's okay to take both of them together. And we purposely chose this in order to make it easier for you to keep track of it. So let's say, for instance, you're going to take your Tylenol at 8 a.m., then take your ibuprofen at 8 a.m. also, okay? And then obviously 8 hours later, you would take both of them together. And so that would be, let's say at 4 p.m., you'll take both of them together. So take both of them together. That'll help you to be able to sleep through the night without having to wake up in the middle of the night to take the medicine for pain. Both of these medicines, it's important to take round the clock for the first 4 weeks after surgery, whether you have pain or not, okay? One of the reasons for that is that if you keep the pain under good control, then the likelihood that you'll need the oxycodone, which we're going to talk about in a minute, is significantly lower, okay? It's a lot easier to stay ahead of the pain than it is to try to catch up on it. That's number one. Number two, there are some studies which have suggested that in patients who undergo surgery, if you have better pain control early on, the likelihood of having chronic nerve-related pain a year later is significantly lower. And so we're trying to avoid that also. So it's not just to make you comfortable now. We're trying to get you a better result later on down the road. So it's important to take the ibuprofen and the Tylenol as it's directed on your discharge instruction sheet and as we're talking about right now, okay? The third medicine that I want you to know about is oxycodone. Okay, oxycodone is a narcotic pain medicine. You can take that up to every 4 hours. You can take up to 10 milligrams every 4 hours. All right, this you only take as needed. If you don't have pain, then don't take it. If you got a lot of pain, then take it. But don't take it any more often than every 4 hours unless you hear from me or Steve otherwise. Okay. This is as needed. And of the different medicines we're going to talk about right now, this is the only medicine that you take as needed. All the other ones you take on a schedule, regardless of whether or not you have pain. Okay, so that's the oxycodone, and this is the one that most people are concerned about because they're concerned about the risk of addiction. This is the medicine that we want to try to minimize the use of if we can. But if you're having pain, it is important to take it because controlling that pain early on has, again, been shown to decrease the likelihood of chronic nerve-related pain a year or two later on down the road, okay? So let's talk about gabapentin. That's the next medicine that you're going to take, okay? Now, some of you will have been taking gabapentin before surgery already, and some of you will have been taking Lyrica before surgery already. If you were taking Lyrica, then ignore what we're going to say about the gabapentin. If you were taking gabapentin before surgery already, then these instructions might apply to you depending on the dose that you were taking. If you were taking a relatively low dose, we're going to increase that dose. We're going to talk about that in a second. If you were already taking a high dose, then you're going to stay on that. You'll notice the details for that in your written discharge instructions, so pay particular attention to that, please. Okay? Now, for those of you that have never been on gabapentin, or maybe you were on it in the past and now you're being asked to take it again, you should have taken a dose of gabapentin, a big dose, the night before surgery. It is important to take the gabapentin every 8 hours for the first 2 weeks after surgery, okay? The ibuprofen you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not, okay? The Tylenol you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not. The gabapentin you're going to take every 8 hours for 2 weeks after surgery, whether you have pain or not. Again, the reason for this is to decrease the risk of chronic nerve-related pain later on down the road, in addition to helping you with your immediate pain after surgery, okay? So the gabapentin you're going to take for 2 weeks after surgery. The ibuprofen and the Tylenol you're going to take for 4 weeks after surgery. All three of those, regardless of whether or not you have pain, okay? The next medicine is a little bit unusual, or at least it may seem a little bit unusual at first, and it's high-dose vitamin C, 1,500 milligrams that you're going to take, okay, every day for the first month, for 4 weeks after surgery, okay? The vitamin C isn't a nutritional supplement in this case. This isn't because we have some concern about whether or not you're getting enough vitamin C or whether or not you have some kind of nutritional deficiency. The reason for the vitamin C is that in some studies it's been shown that using high-dose vitamin C after certain types of nerve-related procedures, it can decrease the risk of what's called complex regional pain syndrome, which is a nerve-related pain problem, which is chronic pain that typically won't show up immediately after surgery There have been some studies which have suggested that taking the high-dose vitamin C will help with chronic nerve-related pain a year after surgery. Okay, it'll prevent you from having chronic nerve-related pain a year later. Okay, so it is important to take it now. You're not going to notice a difference now in terms of how it makes you feel. It will make a difference later on down the road, and so that's the reason for taking that. Okay, the only other medicine that's on the list, I know it seems like it's been a long laundry list of medicine. The other medicine that's on the list that's important for you to take is minocycline. Okay, now for those of you that are allergic to tetracycline or allergic to minocycline, you'll have a prescription for Bactrim instead. But either way, it's an antibiotic that you take twice a day, every 12 hours, and you'll notice again on your discharge instructions it'll say exactly which medicine and for how long. Okay, so you're going to take that every 12 hours for 10 days. Please take it until it's all gone. We should never hear about leftover antibiotics. Leftover and antibiotics don't go in the same sentence together. Okay, so take those until they're gone. That's in order to decrease the risk of a wound infection. If you end up with a wound infection, there is a higher risk of having chronic nerve-related pain later on down the road, not to mention having a more prominent scar. So please keep that in mind. Try to avoid the risk of wound infection. Take the antibiotics until they're gone. Okay. The last thing I want to mention has to do with ice and heat. Okay. Now you may have gotten lots of differing advice from different people about ice and heat. Okay. When it comes to this particular surgery, please pay attention to what I'm about to mention to you now. Okay. It's going to be different most likely than what you've heard from other doctors and from your physical therapist and anybody else as it pertains to ice and heat. And I'm going to go over why we choose to do things a little bit differently. Okay, so for the first 48 hours after surgery, you can use ice. Okay, and a lot of people find that it's helpful in terms of managing discomfort. So use the ice. Don't use it for more than 20 minutes every hour. Okay, but you can use it every hour, but not more than 20 minutes every hour. If you do it more often than that, you do run the risk of developing frostbite. Okay, and so pay particular attention to that. 20 minutes at the most every hour. Okay, that's for the first 48 hours. After 48 hours, do not apply ice any longer. Okay, you can use heat again for up to 20 minutes every hour. And the reason for that is that the ice is helpful initially after surgery because it decreases swelling by decreasing blood flow to that area. Okay, and it also helps with pain for some patients because it numbs up the nerves, kind of like just before frostbite, and that's the reason we don't want to overdo it, because you don't want to end up with frostbite. But the reason we switch to heat after 48 hours, which might be contrary to some of the things you've heard from other people, is that the heat causes the blood vessels to open up, okay, what we call vasodilation. And when the blood vessels open up, it increases blood flow to that area. It increases oxygenation. It increases the amount of nutrients that get to that area. And as a plastic surgeon, one of my highest priorities is making sure that that wound heals as well as possible and as quickly as possible. And the heat and the nutrition and the oxygenation and the improved blood flow ensure that that wound is going to heal as well as possible. Okay? By using ice, what you're doing is you're decreasing blood flow to the area. You're slowing down the healing process. Okay? Now, I'm not telling you to not follow your other doctor's directions if you've gotten instructions about some other kind of surgery and what they're telling you as far as ice goes. Okay? Whatever your other doctor told you about your other surgery, follow those instructions. But when it comes to a surgery that I have done for you, please follow these instructions. Ice for 48 hours. Again, no more than 20 minutes every hour. And then after the first 48 hours, switch to heat. Do not apply ice any longer after the first 48 hours. Okay? Lastly, if you have any concerns or questions that were not covered in this video, or that weren't covered in the written discharge instructions, or there's something that you're confused about, you don't understand, that's a good opportunity for you to call our office or email us at info@draguila.com, or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have. Okay, so don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.